So this is what the true experimental design. Now we'll go for the quasi experimental design. Okay, quasi experimental. So what do you mean by quasi experimental? What is the meaning of the quasi? What do you mean by literal meaning of the quasi? Quasi means, see, first we have seen the true experiment. True experiment, true means what? True. True is a truth, real. Understand? Now here quasi means something is a true but may not true. It is like a true experiment only, but it is not exactly like a true experiment. It is a nearer to the true experiment. Understand? Certain part is missing. Understand? So quasi experimental design lack one of the three essential requirement. What are the essential three requirement? Manipulation, control, and randomization. So one of the component, either control or randomization, is missing. We will not keep the control sometime. Understand? So that is the, or we cannot do the randomization. Okay. So at that time we have to use this quasi experimental design. Therefore, it is considered slightly weaker in the terms of strength of the evidences as compared to the true experiment. It is a slightly different. Okay, so the quasi experimental designs are non-equivalent control group design and time series design. So these are the quasi experimental types. Okay. Non-equivalent control group design is useful when the researcher is interested in assessing the effectiveness of intervention. But due to some reason, it is not possible to have control or randomization. Assign the subject to the experimental and control group. Understand? So that is there. Then the comparable group is also known as a non-equivalent control group, because it is not randomization, so it becomes a non-equivalent control group. Okay, it is not similar to the experimental group in a number of variables of interest. So it is a slightly different from the true experiment. Okay, so here there is no randomization. There will be the experimental group and there will be a control group. Pre-test data, intervention is there, post-test data, and no intervention. Only here randomization is missing. Otherwise, everything is there like a true experiment. Understand? Certain time, why we should not randomize? Because certain time we have to select a sample deliberately. For example, if we are testing something on autistic children, understand, effectiveness of some psychotherapy on autistic children, understand. So we have got our OPD, the patients are coming, autistic patients are coming, so all patients we have to include. So we cannot do the randomization. When specific group we are taking, so there is no chance of the randomization, because there is no option. We have to take the purposive sampling. Understand? For that purpose, if any research is conducted on the pregnant woman, so naturally we have to take all pregnant women visiting to the OPD. Understand? So similar way, diabetes patient, hypertensive patient, whatever the sample is there, it is a specific group of sample. So at that time there will not be randomization. Okay. Another example of the quasi-experimental design is a time series design. Time series are useful to assess the long-term effect of an intervention. Time series, the name itself is a explanatory. Time series means certain time we have to collect the data, maybe after 1 month, after 3 months, after 6 months, after 1 year. So, in which the specific interval intervention is withheld or intensified. Okay, data is collected over an extended period of time. Usually, small group of subject is recruited for the study, which is followed to assess the effectiveness of treatment as well as long-term efficiency and adverse effect. Understand? For example, if you are giving the training, BLS training to the staff nurses, okay, then once we are giving the training and then we observe the its effect, how much retention is done after 1 month, after 3 months, after 6 months, at what level they forget, we have to see, so that the repeat training can be arranged. Understand? So in this way the time series design works. Even certain time for the drugs also we can give the time series, because how much drug is effective is how long it is effective. Certain time we are using short term insulin, long term insulin. So whether that particular effect is sustained in the patient, that also seen by the time series design. Okay. Again the same time series design, how these are the observations are done. Okay. So the advantage and disadvantage of the quasi-experimental design, it provides feasibility to test some intervention that cannot otherwise be studied by using true experimental design. So which is not possible with the true experimental. So at that time we have to use the quasi-experimental. So it is a lack of sufficient control over the extraneous variable. The evidence generated is a weak. So certain times the evidence generated is weak by the quasi, because we are not doing the randomization or we are not involving the control group. Okay, but the quasi experimentals are frequently used by the nurse researcher because of their practical applicability in many situations where true experiments are not possible. So it is a specifically designed the quasi-experimental. Quasi-experimental designs are usually done in the nursing studies. So other fraternities are not using the quasi-experimental. Either they are doing the true experimental or the pre-experimental. Okay. Now the third part of the experimental design is a pre-experimental design. Pre-experimental is again dilution to the experimental design. These are the weakest form of experiment, because here there are two things are lacking. Randomization is also lacking and control is also lacking. No randomization and no control, only the manipulation. Okay, so there is no control, so there is a no control over extraneous variables, and this leads to number of rival hypotheses for the alternative explanation about change in the dependent variable. So when there is a not too much accuracy is required. For example, we wanted to conduct some workshop and we wanted to see the effect of the workshop. At that time, so there is no randomization, there is no control. We have to take the pre-test, give the workshop, and then ask for the post-test. So it is a simple. So there might be there is no any control over the extraneous variable. Okay, so in the pre-experimental design, there is a one-shot case study. And then experimental treatment is applied to a group of people and post-test data is then collected. Means there is there might be one intervention and directly observations. And the static group comparison, two naturally occurring groups are selected. One receives experimental treatment and other does not. Both the groups are then measured, and experimenter compares the two sets of measurement to see if there is a difference. Understand? Again, this static group comparison, again there is a extraneous variables will not be controlled. Okay. Then one group pre-test post-test design. One group is taken. Just now I told you the example of the BLS. Same experimental group, pre-test data, intervention, and post-test data. There is no any control. All the peoples will be given the pre-test. All the treatment, all the participants will be given some treatment, and then we collect the data.